This is Evelyn. Today I'm going to be talking about stroke, which is the same thing as cerebral vascular accident, which is also known as brain attack. What is a stroke? Physiological definition of a stroke is that it is an acute focal injury that affects our central nervous system, which contain the brain and the spinal cord. However, World Health Organization (WHO) defines stroke as a clinical syndrome that is rapidly developing into a focal disturbance of our cerebrum, which is one of the biggest part of the brain, and that it should be lasting longer than 24 hours or leading to death. With no apparent cause other than vascular origin. So now that I've defined stroke, I want to talk about some statistics about stroke, why it's important to prevent stroke. Do you know that stroke is the second leading cause of death globally? And that first-time stroke occurs every 2 seconds, and in every 4 seconds someone have a stroke. And stroke is the largest cause of disability globally. And do you know that stroke affects 13.7 million people globally, and 5.5 million people die of stroke annually? 1 in 20 adult death is caused as a result of stroke, and 80% of that death can be preventable if we put in measures to prevent it. So what are the risk factors for stroke? One of them will be family history. If your parents or your grandparents have a stroke, you're prone to have a stroke. High blood pressure, elevated high blood pressure. If your blood pressure is continue to get elevated and elevated, it's going to put pressure in your vessels in your brain, and you can end up with a stroke. Another one will be obesity. So weight gain, that can put you at risk of stroke. Diabetes can put you at risk of stroke, because what happened with diabetes is that when your blood sugar remains elevated and elevated, what happened in the process is that you're going to build up a plaque. Your arteries are going to get hardened, so your blood vessels is not as flexible as it should have. And what ends up happening is that you can develop a clot, and a clot can travel to the brain, and this can lead to stroke, right? So another one will be non-physically fit. You're sitting down, you're not doing any activity, you are at risk of developing deep vein thrombosis, which means blood clot in your leg that can travel to any part of your body. If the brain can cause a stroke. Another one will be smoking. What smoking does is that smoking constricts your blood vessels. It makes your blood vessels smaller, and what that does is that it puts pressure in your vessels, and that can cause pressures in the vessels of the brain, which can lead to aneurysm, and that can lead to stroke. So all of this can be preventable with medication, with change in lifestyle, with diet, whatever you can do to stop that from happening, which is why stroke is preventable. High blood pressure is preventable. You take medication. High cholesterol, it's preventable. You can take medication. So it is important that we take care of our body. So I'm going to just talk about a little bit about the anatomy of the brain, how blood supply works in the brain, so that way we're able to understand how the blood flows in the brain. I'm actually going to focus on the cerebrum, which is the biggest part of the brain. The cerebrum, what the cerebrum does is that it does the judgment, the thinking, the execution, the emotion, the vision, the sensory. It does the learning. It does basically most of all our learning. It's as a result of the cerebrum, which is our bigger part of the brain. The main blood vessels that supplies the brain with blood coming from the heart. So remember when I talked about the circulation? So I'm going back to the heart now. So the blood is oxygenated. Once it's oxygenated, it goes into the left side of the heart and ends up in the left ventricle. From the left ventricle, aortic valve is triggered to open, pass through the aortic valve one way into the aorta. So once it gets into the aorta, it splits open. There's an artery called the common carotid artery that is actually leading to the brain. It's on the neck. It's at the neck region of our body. So it comes in there at the neck. then that will split open. There's actually two arteries that's involved with supplying blood to the brain. There's the vertebral artery and there's an internal carotid artery. Internal carotid artery is actually coming from the common carotid artery, which, because the common carotid artery is found in the neck. So once it gets to the brain, it splits into two, and then one will be the internal carotid artery that goes into and supply blood to the anterior part of the cerebrum. So the vertebral artery will go into the posterior part of the cerebrum. That's how blood supply works, and all of that happens. They give the brain oxygen for you to execute, think, learn, feel emotion, see, memory, learning, actually even walking, all that kinds of things. The big things is the cerebrum, is the function of the cerebrum. That's what they do. The other part of the brain called the cerebellum, the pituitary gland, the amygdala. We have the hypothalamus and the thalamus, but I'm not going to focus on that. I'm just actually going to focus on the cerebrum where the stroke happens. So you can imagine when you have a stroke and there is no blood supply to this region, you can see your emotion is gone, your learning is gone, your execution is gone, how you think, how you learn, how you walk, how you see, all of that is gone. We need oxygen to our brain, and we need this oxygen for the brain to walk. So this is very important. So there's two types of stroke. There's ischemic stroke and there's a hemorrhagic stroke. The ischemic stroke is the most common type of stroke because it is the one that is caused as a result of blood clot. Risk factor for blood clot would be even atrial fibrillation, because I explained how atrial fibrillation will develop a clot, and the clot will end up traveling, and it can move into the brain and cut and block that area of the brain, the blood vessels. So once the clot blocks that area of the blood vessels, there's no oxygen supply to that place. What end up happening, there's pressure build up in there, and you can end up with stroke because there's no oxygen supply, there's no blood flow in that region anymore. So another way that this stroke can happen is as a result of high cholesterol, high fatty food, which end up building plaque in the vessels of the body. So what end up happening is that it's going to get the artery to harden. I think I mentioned that before. So the artery is hardened. It's not as flexible as it should. So what usually happens is that when blood is flowing, it becomes narrower, and they start to build this plaque where it narrows the blood vessels and putting pressure on it, and eventually it becomes a clot and move to the brain, and this can cause a blood clot, which will block the cerebral part of the brain. And what ends up happening, that can lead to stroke and all those kinds of things. So my second one is the hemorrhagic stroke. Hemorrhagic stroke is caused as a result of rupture in the blood vessels of the brain, where the blood starts to leak out of the vessels. What ends up happening is that it's going to build pressure in the brain cells, and this can cause damage to the cells of the brain. So in that case, the area of the cerebellum where that leaking takes place is gone, like it's damaged. So there's nothing you can do. Once a brain cell dies, you cannot replace it. So that is why hemorrhagic stroke may be the less common, but it is the most dangerous. So another cause of hemorrhagic stroke is an aneurysm. An aneurysm is a bulge-like a ball that can stretch, and if you're able to stretch, you're able to burst and open up, and the blood is leaking into the brain cells. What ends up happening is that it's damaging all the area of the blood cells, all the area that the blood is leaking to, and this can cause brain damage. So hemorrhagic stroke, as I mentioned earlier, it is the most deadly. So it is important that we act fast, because stroke is a medical emergency. So because stroke is a severe medical condition, it means you require medical emergency. So there are 4-letter words that I'm going to describe how to know that someone is having a stroke. It's called FAST, fast. The F means the face is drooping. The A means the person cannot raise his arms. The third one will be sludge and gobbling speech. The speech is not clear. It's like you can't talk right. And the fourth one is time. Call medical emergency right away. I cannot stress this enough. 911. When you see somebody's having that sludge speech, they can't raise up their hand, this is the time to call 911. This is not the time to play. So those are the 4 cardinal signs that the person is having a stroke and a medical emergency is required. As I've said before, most stroke can be preventable. 80% of them can be preventable if you are able to get the right treatment.